Dr. Lee Jones with Behringer Ingelheim Animal Health, formerly from University of Georgia, is going to talk to us about herd health and specifically looking at vaccinations as part of the herd health program.
Yeah, so thank you, Dr. Whitley. It's good to see you, Dr. Noble. Thank you, Handy, for the invitation. So if we look at herd health and we're looking at vaccinations as part of our herd health program, really and truly, when you look at the total herd health program, it's primarily a good nutrition-based program. And then our preventative health program includes biosecurity, how we introduce new cattle and whether we bring in more than whether we bring in trouble with live cattle, our vaccination programs, parasite control. These are going to be the two parts that I focus on tonight. Fertility of the herd, and it goes toward production. But we want to protect the fertility of the herd, as we were having this conversation before. That includes some bull evaluation, condition of the cow herd, controlled breeding program, replacement heifer plan, good records, treatment plans, and of course, humane handling all play a big role in a overall herd health program. Where do you get information? From all kinds of places. Those of us, Dr. Noble in Extension, I have been in Extension, so hopefully he and I are really good sources, reliable sources for good information. Dr. Nikki and other folks, and some of the work that's been going into putting in webinars like this. Industry people like me now. I did move out of Extension into industry, retired from UGA. Good publications, reliable articles. When we're talking about a vaccination program, I've had people come up to me and said, well, can you help me develop a vaccination program? And I said, okay, what do you want to do? And they look at me like maybe I didn't get my DVM from a university. I might have gotten it out of a Cracker Jack box. Anyway, so I need to look at the who, the what, the when, and why of a vaccination program. So what is the who? The who is my cow herd, my heifers, my open heifers, bred heifers, first calf heifers, nursing calves, weaned calves, and my bulls. I don't know if you ever thought about it, but we have 8 different static types of cattle in each and every herd, and not all these get vaccinated the exact same way. So that's the who. What am I going to, what kind of vaccine am I going to use? You've got this killed product right here. You've got this combination product right here. You got this modified live killed lepto product right here. So it's very confusing. What kind of vaccine should I use? Being an injectable? That's the kind that I use in my own herd. Is it going to be a virus vaccine? Yes, we want viruses. Is it going to be a killed? Is it going to be a modified live? Or is it going to be this combination? Do I need bacterin and toxoids, kind of like the 7-way blackleg shots? Do I use intranasal vaccine, or in the case of scours, oral vaccines? What are the significant antigens? When I use the word antigens, those are the things we vaccinate against. Do we need lepto? Vibrio is a sexually transmitted diseases from bulls. What kind of viruses do I need? Other things like scours, pink eye, or blackleg. When I look at the viruses, the main viruses that we have in our vaccines are bovine herpes virus, also known as IBR, infectious bovine rhinotracheitis. Some people knew it as red nose back when we had Hereford cattle and you could actually see a red nose versus Angus cattle that you can't tell. And it is a reproductive disease, but it's also a respiratory disease in some calves. BVD, bovine viral diarrhea virus, types 1 and 2. Again, it's a reproductive disease. Unlike the name implies, it's not a big-time GI disease, but it's mostly either a reproductive disease in adult cattle or it's a respiratory disease in calves and stocker calves. And it does create what's called a persistently infected calf, what we call a PI calf. And that's important to know that because that's how it perpetuates in our herd. And I can assure you, of all the people that we have here, I can almost guarantee, because 1 in 10 or 12 herds has BVD in it, that we have a herd or two within our listening audience that might have BVD in their herd. And it's important to try to work through that. Bovine respiratory syncytial virus is a respiratory disease, just like RSV in humans. And it doesn't typically have a reproductive component. And then parainfluenza 3, PI3, not to be confused with PI calves, but parainfluenza is a respiratory. And of course, rota and corona, which cause diarrhea in calves, and coronavirus can also cause a mild pneumonia in calves. So the respiratory bacteria include Manhenia and Pastorella, the most common, Haemophilus somnus, Mycoplasma. In the pink eye, we have Moraxella bovis and Moraxella bovaculi. Reproductive, brucellosis, which we don't have in Georgia right now, Brucella abortus. Now we do have it in the wild hog population, but that's a different Brucella organism. Lepto is from the environment. Campylobacter fetus is Vibrio, gets from bulls. There's Somnus again. E. coli, Salmonella, and of course blackleg, all the clostridial diseases, which are absolutely, I'll talk later, being a core vaccine consideration. So on the cow herd, really we're only using annual boosters because we've set those cows up well before they were replacement heifers, and we followed through the replacement heifer period with a good vaccination program. I'll talk about that in a few minutes, but I'm talking a little bit about what we're doing with our cow herd. Hopefully, if I've done my job well, my cow herd is just on a maintenance kind of program. Don't have anything, a lot of effort, because these are the cows that should be paying us back year after year with a live calf. And all I have to do is maintain those cattle in good body condition, maintain their health, and they're going to continue to produce that calf. So first calf heifer, that's good nutrition program, body condition, and then the vaccination program is going to be the same as the cow herd. So we vaccinate for cow health, animal health, herd health. We vaccinate to protect cow herd fertility. That's production for us. A vaccination program is going to help us get more calves from our cows, and that's pretty important. Also, the vaccination program in the cow herd is going to help with enhancing colostrum. That's very, very important for that calf's health in the first couple of months of life. So when am I going to do that? I might either do it pre-breeding or I might do it at pregnancy check. And depending on the situation, if I've got a really bad problem with lepto or something like that in my environment, I may have a vaccine at both times. Usually it's one or the other. If I'm using vaccine pre-breeding, we stimulate immunity prior to breeding exposure, and I can use a modified live. It's very safe in pregnant cows. I can use something at preg check that enhances colostrum. I can use a modified live at this time, but it requires a previous vaccination program with the same product. So it might be better to use a killed product like this in this bottle here because it's convenient and it's safe. If I go with a modified live program in pregnant cows that haven't been previously vaccinated or are not on a good vaccination program, I can cause abortion and actually cause the very problem that I'm trying to avoid. So I have to be careful there. And my calves, ideally, I would like to start around 2 to 4 months of age. Some people say that, well, that's too early because you've got maternal antibody. We have really good data that shows that calves can respond to vaccines, and it does improve antibody production and protection through the nursing phase. And so because calves can get pneumonia as the maternal antibodies decline, and they will decline. I guarantee you they're going to be down to nearly nothing by the time that calf's 3 to 4 months of age. So it's a good time to go ahead and get a vaccination program into them. A respiratory disease includes a 5-way. That includes that IBR, both types of BVD, BRSV, and PI3. I prefer a modified live at this age. Some people want to get a killed in there. The problem with only one killed is that it's not a sufficient vaccination program, and it does require a booster at 30 days. It does require a booster at 30 days. Killed vaccines require a booster at 30 days. If you do not give the booster shot, you're fooling yourself and you don't have a vaccination program. So a modified live can give a really good protection with one dose. It's very effective. It gives a very robust vaccination and um, and a very, very vigorous, a very strong vaccination and a quick vaccination stimulation. 7-way blackleg is absolutely essential. We're going to call it our core vaccine. There's no reason in 2023 that every calf should not get at least one dose of 7-way. Maybe a second dose, a booster dose would be necessary, though some of our vaccines do give good protection in a single dose. Read the label. And then again at pre-weaning and then at weaning. So if I wean my calves and I background my calves, I'm going to get 2 more doses into them. So transition to a modified live at that time if they're already on a killed vaccination program. 2 modified live vaccinations pre-weaning appear to protect calves that move into stocker and feedlot. Plus, it increases the value of those calves. And the other thing that I really want to emphasize is castrate bull calves. If you're listening to this talk and you want to try to figure out how to make more money on your calves, I looked at the market today, and the difference between a 500-pound steer and a 500-pound bull sold today, this week, at a sale barn is $125. Yes, $125. If you do not castrate your bull calves before you sell them, you're giving somebody else your money. You're not collecting it yourself. I don't know how emphatic I need to be. If you want to make some money in the cow herd, don't give money away. Collect as much of it and keep it as much as you can. So castrate those bull calves. If you're squeamish about it, hire somebody to do it. Find out how to do it right and do it. But it will make you money right now. If you're selling 10 bull calves, you just made an extra $1,200 easy. So replacement heifers, we're going to build off of the model of the program as a calf. We're going to have a modified live, and then I introduce the Vibrio Lepto. I'm going to get that into them at weaning time when I've identified my replacement heifers. I'm going to revaccinate pre-breeding, and then I'm going to vaccinate with a different vaccine at pregnancy diagnosis. This has given her 4 rounds of vaccinations by the time she's preg checked. That is a solid foundation. And at that point, I have options. And that's really, really important because at that point, I can either do annual revaccination with the killed product or I can use a modified live. And those cows are very well protected. It's okay to use modified lives in bulls. Pretty much I'm going to vaccinate bulls the exact same way as I vaccinate the cow herd. Timing might be off a little bit, but I'm going to vaccinate him the same way as I vaccinate the cow herd. The effectiveness of the program, the right technique, use sharp needles, change often, reduces inflammation. It's a sub-Q under the skin injection. We want to keep our vaccine cool, out of direct sunlight. We're only going to mix what I can use within an hour. So typically I only buy 10-dose bottles. Apply low stress handling, good facility design, good body condition. They're not sick. They're not thin. They're not poor. They're not parasitized. They're in adequate nutrition. Follow beef quality assurance. We've talked about that with this group before, how important BQA is. And we don't need to vaccinate for everything. There's a lot of things to vaccinate for. We don't need to vaccinate for everything. Look at this picture down here. You see this person's vaccinating close to a dirty place on the hide. That is a great way to get an injection site abscess. Try to find a clean spot. If you can't find a clean spot, keep a curry comb or something handy at the chute and make sure that you get that in the right location and done well. This is a perfect injection in front of the shoulder, the neck's right here, the head chute's right here, and of course the cooler keeps vaccines cold. We want to avoid overload, too many vaccines. We want to split vaccines on both sides of the animal, and we want to design our vaccination program for our herd, knowing the risks that are in our environment. So this is a core vaccine that I really, this picture is actually from the article that we shared, Handy shared with you. So for steers, we want to make sure they get BVD, IBR. So this is the 5-way. For heifers, the exact same thing. And for cows, the exact same thing. But for cows, it might be a killed vaccine. For calves, it might be a modified live. It's the same vaccines, one version versus the other. Campylobacter vibrio, it's only a breeding type of disease, only from bulls. So if I'm vaccinating heifers and cows prior to breeding, I'll use it. If I'm vaccinating at preg check, the risk is gone. I don't need it now. So I may not have it in my vaccine. It actually saves a little bit of money. Lepto is absolutely important, but not for steers. Okay, steers are going to the feed yard. They don't necessarily need that. It's mostly considered a reproductive disease. Pink eye, everybody's susceptible to pink eye. Mannheimia pastorella is mostly a feedlot disease. So my steers are going to get Mannheimia pastorella if I'm marketing them. So this would be looking at kind of a core chart. Bee quality assurance, y'all know that I preach it. I preach it, preach it, preach it, preach it. BQA is a good program to reduce injection site lesions, chemical residues, reduce carcass damage from handling and transportation, proper vaccine drug use practices, preventative management, emphasis. This is going to get annoying. But anyway, certain feeds cannot be fed to livestock, like meat and bone meal to cattle. Good management practices, good handling practices, and that includes all of these things. So certainly can go to these websites and find BQA information. And if you're not certified, I certainly encourage you to be that way, because go ahead and get certified, because there's really good information through that program. Just animal husbandry, good humane handling, all of these things. Low stress management, timely proper castration makes you money, and is better for the calf. It's better for that steer calf, because somebody's going to take them off. And the older they get, the harder it is on them. Cattle disease is an animal welfare issue, so I preach prevention. A good benefits is plain good sense. Oh my goodness. Satisfaction doing the right thing, handle cattle effectively, improves response to procedures, less chance of injury to cattle, reduce sickness, reduce injury, reduce damage, just overall better quality beef. So if there's no questions on vaccinations, I'm going to move to internal parasites.
Dr. Yeah, personally, I guess what I struggle with is trying to come up with a protocol. The problem that I'm running into in my herd is that it's trying to give it to them when they're not pregnant. So basically, my cows have calves between January and March. And basically, I put my bull back in probably like on the 25th of March. And so trying to determine when to give my brood cows that modified vaccine is always a challenge when they're not pregnant. That's what I struggle with, trying to come up with a protocol when I can give my calves, because you don't want your calves coming in contact with pregnant cows, right?
Yes. Now, that's what the label says. All right, so I'll use this as an example. This product up here requires mixing. Now, so does Cattle Master, but Cattle Master is not a straight up modified live. But this product, this Express product, requires mixing. So it's a modified live. Okay. This product is Triangle 10. These two right here have the same stuff in them. But this one is killed. This one down here in the pink bottle. This one's killed. And so it comes already mixed. Now, this one is the one that is safe to give to I can honestly say it's safe to give to everybody that's listening. There's not a lot of challenges with it. It's safe, but it does not create the same level of immunity that the modified live does. This one's worth getting into. If you can't get your cow herd vaccinated, then I would say that we need to start with our replacement heifers and get them in the modified live program. If they have nose-to-nose contact and they're not stressed, it's probably not that big of a deal as long as I'm doing a pretty aggressive program. I can give a kill vaccine 3 or 4 times in a year, honestly, just whenever I can. Now, that's not perfect, but it's better than not giving it or only giving one shot. But a modified live is something that my timing kind of matters. My timing before breeding matters, and my timing, when my calves are there. Now, like right now, if you're fully calved out and your bull's not in there, then you can vaccinate all the calves that are on the ground with a modified live, and the cows too, because nobody's been exposed to a bull. But if you got pregnant cows and open cows and kind of a mixture, then you may be better off to try the killed. The whole business of shedding is real. Okay, modified live vaccine viruses can shed. And so according to label, if we want to stay on the label, but if your veterinarian, the person that knows your herd health program the best, has a sit down with you and talks about the risks and the rewards, then you guys might say, you know what? We might not be totally on label here, but I think we're okay using this. This is that one-on-one conversation on your farm to where you're talking about the pros and cons of some of the vaccination strategies. So I hesitate to say anything too broadly in this group because I don't know everybody and I don't know your farming situation. So we always recommend to follow the label instructions, but you can, under certain circumstances, conditions, situations, depending on each and every farm, you can actually deviate slightly and is actually considered a good management practice. But to just across the board say that you don't have to worry about those kind of things, that's just not right. I mean, that's not correct at all. So does that answer your question? As far as timing now on this schedule here, so if I look at my cows, my 2 options, of course, as I mentioned before, are pre-breeding and preg check time. You could use that kill vaccine at both times if you wanted to, Handy. That would be perfectly fine in your cow herd, and that would be a decent program. Not as good as having had a modified live in there, but all your replacement heifers, there's no reason that they shouldn't have had a modified live at some time between weaning and breeding, right? So my replacement heifers are going to be moving up in a better vaccination program, and of course my steers, they're gone off the farm. These 2 groups can stay together. You can vaccinate a steer with this vaccine if you only wanted to use one. It's unnecessary expense because this adds about $1.50 or $2 per dose, so you can save money on your steers. But if you just wanted to try to get one vaccine to do everybody, you could do that. But I would definitely focus, if you have a difficult situation, I would focus on getting my heifers on a good modified live program and trying to breed them and vaccinate them separate from the cow herd. Does that help answer any of your questions or
Absolutely. So basically, get my heifers up to with the modified live before I put them in the herd, and then once they get in the herd, all I have to worry about then is just doing a kill.
That's right.
That, doing preg check or
That's correct. And right. If you're concerned at all, you can do both with the kill.
You said, so how many modified live you think my heifer should have before I put them back into the main herd?
2 or 3.
2 or 3. Okay.
Yeah. So if you gave your heifers a modified live, just a straight up only 5-way, and then come back later with a modified live 5-way that has lepto in it, that's 2 doses. Okay, that's 2 shots because they've gotten the 2 doses of modified live, and so that will probably be a good vaccination program.
Okay.
A lot of times with my heifers, they get 2 modified lives by the time they're weaned, and then they get another dose between weaning and breeding.
Okay, so you're not concerned when you give them a modified live before weaning that it's going to affect the cow if they're pregnant. So that's what I'm struggling with. That's why.
Well, see, this is what I was going to ask Dr. Jones, and this may help handy. If you work with your vet and your vet says you've got good immunity, these are older cattle, they probably have some immunity, plus you're given the kill vaccine, so you may be okay as long as the calves are healthy, blah, blah, blah. Or you could, and I'm asking Dr. Jones this, is it possible if you're going to background those calves to start the vaccinations with the modified live at weaning and do 2 rounds after, like 1 at weaning and 1 after weaning? And
Yeah,
that
you
way they're
can't.
not exposed to your calves or to your cows, but they get their 2 rounds.
Yeah, you can do that. If you want to do that, you can absolutely do that. And for this group, as we're talking, that probably be the most effective program. You know, I do know people that have had a really good background vaccination on their cows as replacement heifers. And then so when those cows move into a cow herd, then you can vaccinate their calves with a modified live too. But as per label, we definitely recommend, if you can, to try to get those cows vaccinated with a modified live. In Handy's situation, Nikki, Dr. Whitley, I think that would be a really good idea to stick with a modified live at separation. When you separate them from the cows, you can get them onto a modified live program at that time. And you have time between weaning and breeding to work in a 2 or even a 3 dose program before breeding on your replacement heifers. So you get an aggressive modified live vaccination program in the calf herd, and then over time, as I replace my cows with heifers on a good vaccination program, then that's going to give me options in my vaccinating my calves. Does that make sense? So if I'm restricted by my cow herd vaccinations, then if I want to stay on label, I really need to vaccinate like you were talking about and start the modified live program at weaning, at separation.
Okay.
Yeah, I think that may be safe for a lot of people because if you've never vaccinated before and your cows you're always going to have some pregnant cows in there, or it's too close to breeding by the time everybody calves to give a modified live,
Yeah, you
because of
cannot use a modified live in calves that the cows have never seen a modified live. You
right,
cannot do that.
right. So
You
most
didn't
people,
hear me say that you can in this
right.
program. So I don't want anybody to believe that that's what I said, because that's not okay.
Right. So I think most people that we're talking to now have that situation where they have cows that maybe not, you know, have not had a modified live, or they don't know what they've had because they bought from somebody else and they're not sure what that vaccination program was, or maybe they just had killed. So to just be safe, to do a weaning and then the second shot after weaning so that they're away from pregnant cows when you give it. And then, like Dr. Jones was saying, eventually, if you're always giving modified lives to your replacements, eventually your replacements will be your herd. And so everybody will have had it.
Okay. I got it. Thank you, Dr. Jones, Dr. Willis. Thank you. Okay.
Yeah, good. So yeah, there's definitely a lot to this. Hopefully my voice will last through a parasite talk. So the internal parasites we care about are Ostratasia, Homuncus, and this is a different kind of Homuncus that affects sheep and goats, just a different species. Trichostrongylus, Cuperia, and Nematodyrus. So typically cows get infected through grazing. Then those parasites damage the intestinal lining, the stomach or the small intestine, and that can cause hemorrhage, anemia. And then Coccidia and Cryptosporidia are typically parasites of calves. So the Ostratasia life cycle, the eggs are passed in the manure. The larvae goes through several stages till they get to L3, the infective stage, in the pasture next to the manure pat. Cows consume the L3 stage when they graze, and then the L3 stage invades the lining of the abomasum, the true stomach. That's this right here. You can see these nodules, and that's all L3 infestation of the stomach lining of a cow. It invades the lining of the abomasum. They develop into an adult, and then they just come out. They just emerge from the lining and cause all that damage. One type actually kind of goes under what they call hypobiosis. It just kind of stops development because certain times of the year is unfavorable for emergence. And so then these things build up. I've seen this to where there was almost no normal lining of the abomasum, and it had obviously killed the animal. Homuncus, similar life cycle, does similar things, and this is just an example of a bunch of larvae sitting in a dew droplet on a blade of grass. If I can get this to play, yep. Look at all those homuncus just swimming away in there. That animal died, but you can see all those parasites swimming in it. This is a real necropsy. And that's what some of these animals have that level of infestation. Cuperia infects the small intestine, same kind of egg as Ostratasia. Liver flukes, if you're in Florida, the coastal region, liver flukes are actually picked up a little different way, but still through grazing. As a snail actually activates the larvae, the eggs, and then these cercaria are actually picked up, and then this thing goes through and causes some severe liver damage. And I'll talk about that in a few minutes. So coccidiosis is a common disease of young cattle at weaning, typically causes a bloody diarrhea. We treat it different than worms because it's not a worm. Usually it's not fatal, but it can cause some other problems. These calves have, like I said, a really, really nasty diarrhea, and we have to treat them either in the water or in the feed, typically. We can dose them orally, but it's easier to treat them in the water and the feed. So historically, we've recommended what we call a holiday schedule. Early spring or mid-spring, which is Easter time. Midsummer is July the 4th, or fall, Thanksgiving. And people have typically dewormed once or twice a year. Unfortunately, since pour-on dewormers came out, convenience, and now that they're generic, that's all people have used. So we've got a problem. Now, we'd recommend it because it increased weaning weights, fertility, and milk production. But routine deworming doesn't help everybody, because routine deworming of a cow in really good body condition doesn't necessarily mean she's going to produce more milk, and it doesn't necessarily mean she's going to produce a bigger calf. Because if a cow's in really good body condition, she probably doesn't have very many worms to worry about. Definitely not worth treating. We talk about classes of dewormers. The benzimidazoles, that's our oral drenches. That's Safeguard, Panacure, Synanthic, Valbazen. The macrocyclic lactones, these are the injectables and the pour-ons. They're ivermectin, epinomectin, duramectin, moxidectin. These are the brand names for that. And the thiazoles, that's levamisole, that's Levamed prohibit. Some people with sheep and goats would recognize this. This used to be our old Tramadol product that was taken off the market. Right now, we can get this in a powder to mix up for a drench, or it does come in combination. Zoetis has a product called Valcor. It's an injectable. It's a mixture of levamisole and Deworming. There's another combination product, Ivomec Plus. It's got chlorcelon in it for flukes. So if you think you have a fluke problem, your option is Ivomec Plus. You can treat for worms, and you can also treat for flukes. So there are some combination products out there available. If you just if it's being recorded, you can look back at this chart and just look at all of the different things. Some of our oral dewormers do not touch any kind of lice or mites or anything like that. Some of it's good for dairy, some is not approved for dairy. There are different things, some withdrawals and some different applications. So just all of these different options over here on the side, some of the Cydectin, Dectomax, Epronex, long range. You can see long range has a extended duration. It's actually longer than all of the others combined. So that's a product some people like. It is RX only because it's a 5 times stronger. It's a 5% versus these other ones are a 1%. So internal parasites in cows, well-managed cows, is very rare problem. I can do fecal egg analysis and I can hardly ever find worms in most adult cows, older, mature cows. It does suppress the immune system. The effects depend on the production group. Calves and yearlings are more vulnerable. You can get subclinical loss, such as weight loss, production losses, or you can get clinical disease, which would go with a very severely emaciated animal. And then not all animals are equally affected. Even in a severely infected herd, some animals are not going to show any signs, and some animals are almost going to be dead. Again, weight loss, reduced digestion, reduced milk production, lower body condition, immune suppression, delays puberty in heifers. Definitely important to deworm heifers if you want to get them pregnant. Delay the cows coming back into heat after calving, and it can cause anemia. In calves, again, unthrifty appearance, immune suppression, severe anemia if it's a severe infestation. So parasite resistance, I mentioned that about overusing porons. Parasite resistance is real. The frequent abuse of cheap porons is use of only one product time after time, year after year, month after month in the summer. Continuous grazing the same pasture. I treat cows, turn them out on there. It just cycles that. Underdosing. How many people actually use a set of scales? They just throw a little bit on, thinking it's going to be effective. All it has done is increase the resistance in our parasite population. Porons have a delayed effect. Oral is immediate. It gets right in the environment. It's a purge dewormer. Okay, if I dose it correctly, it gets right in there where the parasites live. Injectable is also quick to the gut. So just understand that each of the 3 approaches have their limitations. And if I underdose a poron, I may never get to an effective level within the intestines. Parasite species have shifted. We see more Cuperia now than Ostratasia. Cattle parasitism still has a dramatic impact on production. Resistance is increasing in some management practices. All of our products are still effectively, if used correctly, but we still have to use them properly. We do see resistance. Somebody said, well, at least they're cheap. It doesn't matter if they don't work, any expense is too much. So now what do we need to think about? Something called refugia. And what that means is, since I cannot guarantee that I can clean up my pastures and clean out my herd, I'm always going to have a percentage of parasites out there on the pasture, I want to make sure that those parasites respond to my deworming practices, not that they're super parasites and ignore my deworming. So I want to reconsider routine control. Okay, I don't want to just continue use one class of dewormers constantly. I want to rotate. Okay, I want to maybe combine. Okay, some people can combine classes. All right, so but you just have to be careful there because this is extra label. But that is an approach that in the science, some people have used an oral product and an injectable product at the same time and showed a dramatic decrease in parasite knockdown. Okay, so that might be something to work with your veterinarian to talk about. Treat thin cows and young stock. Anything that's at risk, not necessarily cows in good body condition. Do fecal evaluations. And this is going to test, one, do I need to treat? And two, did it work? So a lot of companies, including mine, will help you take fecal samples, pay for the sampling, and then at treatment, and then come back in an appropriate amount of time. If I've got an oral product, I can come back in 5 to 7 days. If I'm using injectables, probably going to be more like 2 weeks. Okay, because it just takes time for injectables and porons to work different than oral products. And then not all of the nematodes are equally susceptible. Cuperia tends to be more resistant than Ostratasia. So sometimes we're treating one versus the other. So it's important to know which one I'm dealing with. So refugia, what does that mean? That means that some worms are not exposed to my dewormers and I don't have selection pressure on them. The goal is to increase the population of susceptible worms. And selective treatment is how we do that. So we don't always treat every animal every time. Don't deworm all cattle if there's very few parasite. In the summer, when it's hot and dry, there's not a lot of parasites on the pasture. That's not a good time to deworm. I want to deworm this time of year if my pastures are pretty decent. My season, it's hard to say it's cool already in October, but as things kind of cool down in the fall, might be a good time. Spring might be a good time. In the southeast, we probably have parasite exposure nearly around the clock, around the calendar, except for the summertime. So we probably have parasites on pasture all the way through winter. In colder climates where it actually freezes and stays frozen for a while, we probably don't have parasite exposure during the winter, and maybe during the summer. So depending on where you live is going to be your deworming strategy is going to change. Don't use the same class of dewormer all the time. Switch it up. Don't use a dewormer immediately prior to moving to a new pasture. What are you doing? Okay, you're actually taking resistant eggs to the new pasture. Okay, selectively non-treat. There's going to be some cattle that don't need to be treated, and you're going to save money by not treating them. Pasture rotation, grazing management. Don't continually graze the same pastures. If you do, you got to be very, very careful about your deworming program. I've heard about this mixing species. That's included there. Selective culling for parasite resistance is heritable. Some animals they are resistant to parasites. So I have to be careful how I say that because we're talking about parasites that are resistant to our drugs. But we do have cows that are more resistant to parasites, just like sheep and goats. Fecal sample to determine if my program is working. Sample the day I treat them, and then sample 2 to 3 weeks later to see if we get a good knockdown. Dr. Kaplan, who used to be at UGA, said we just need to rethink how we're using our products to maintain these products' efficacy. So avoid the temptation to manage with drugs. We want to use good livestock handling practices. Herd health includes biosecurity and good nutrition, and animal health is important for production and fertility. So with that, I'll take any questions on vaccine and or parasite management.
Any questions?
All right. Well, I've enjoyed spending a few minutes with you tonight. And if there's any questions, feel free to reach out to Handy or Dr. Whitley or even Dr. Noble. Send an email to me. Be glad to follow up with any questions that come to mind later.
You used to hear Tandy tell you to deworm all the animals. And so we do have farmers that are practicing old techniques. They did it because their father did, but as we learn new science, we need to keep up to date so we can learn the new practices. Because most of the time, they always help us save money.
Yeah, I mean, I totally agree with saving money, but in some cases, you got to spend money to make money.
Yeah. Mm-hmm.
The program to look at dewormer efficacy, you said that Behringer Ingelheim will do fecals for people.
Right. So if you're using one of our products, and you're running the cows through the chute, and you're pouring them with one of the products, or you're using the Synanthic oral dewormer, we can collect you can collect fecal samples that day and send them in, and then come back a week, 2 weeks later. We need the samples from the same animals. In other words, if you collect samples from cows 2, 4, 5, 6, 8, 10, 12, 14, and then come back, we need samples from all those cows marked on the same container, because we're trying to compare specific from one animal to another, because as has been said, 80% of the worms, I didn't say it tonight, but 80% of the worms live in about 20% of the cows. And not all the cows have the exact same worm burden. So we need to make sure that we go back and we test samples from those exact same animals so that we can compare how effective the dewormer was. It may be that you find out that, oh my goodness, we didn't have very many parasites in those cows to start with. And if you start at very, very low, it wouldn't surprise me if we didn't see a big change. But if you start very high, then we want to see a big change. We want to see a big reduction. That's our goal. So we would actually do 2 samples, one at the beginning and then one afterwards to compare. And we pay for that.
And Dr. Jones, could you name the products that BL makes? What are their products?
So BI has Eprinex Poron and Ivermectin Poron. They have Ivermectin injectable and long range, which some people will be familiar with, because long range does have a long extended, and there's certain ways to use that product effectively. I would never give long range in like May or June in the South, because you're going to have it in a time where it's not going to be that beneficial. So, and then the oral product is called Synanthic, and it's a low volume dewormer. It's an oral dewormer, Synanthic.
Everybody has any questions? I want to thank Dr. Jones for giving a good presentation for us tonight, and thank everybody for coming.
Well, thank you once again, Dr. Jones. I really appreciate you reaching out to us and still providing the quality service that you always did. So I really appreciate it.
Well, thank you for the invitation, Handy. I really appreciate it. It's also good to visit with you, Dr. Noble and Dr. Whitley. So if y'all need anything, don't hesitate to reach out.
Thank you again. Goodbye, everybody.
Thank you.